Good morning, everyone. I am presenting my paper titled Outcome of Cataract Surgery in Patients with Coexisting Ocular Pathologies that Cause Technically Difficult Surgery. There was no financial support or sponsorship, and there were no conflicts of interest. Cataract is responsible for around 50% of all blindness globally, more than 90% of which is found in low and middle income countries. Despite millions of cataract surgeries done each year, cataract still remains a major cause of blindness all over the world. According to WHO, there is a 25% decrease in blindness prevalence in India, which may be attributed to the increased rate of cataract surgeries in the country. At the same time, the proportion of the aged has also increased significantly in the country, which means the population at risk of blinding cataract has also increased. With increasing age, associated systemic and ocular comorbidities may also increase. The World Health Organization recommends that poor visual acuity, that is less than 6 by 60, or borderline visual acuity less than 6 by 18 to 6 by 60 following cataract surgery should not exceed more than 5% each after best available correction. Cataract surgeries in the presence of comorbidities does not always result in optimal outcome and are associated with many technical difficulties during surgery. Learning to recognize eyes which are at greater risk and acting accordingly helps to prevent or minimize complications. Along with that, such patients may be counseled preoperatively about possibility of poor outcome. This helps in improving postoperative compliance and follow-up. Knowing about ocular comorbidities also helps in better planning the surgery and anticipating any likely complications and preparing for the same. The aim of the study was to study the complications of cataract surgery in eyes with coexisting ocular pathologies and their outcome. After obtaining approval and clearance from Institutional Ethical Committee, a case-controlled hospital-based study was done in the Department of Ophthalmology, Sri Ramamurthy Smarak Institute of Medical Sciences, Bareilly, Uttar Pradesh, to study the complications associated with cataract surgery in eyes with coexisting ocular pathologies and their outcome. Patients who were above 40 years old presenting to the OPD with cataract and existing ocular comorbidities were included in the study. The exclusion criteria were any retinal pathology, glaucoma, intraocular foreign body, microphthalmos, nystagmus, squint, corneal or scleral tear. 100 patients fulfilling the criteria were included in the study, and 100 age and sex-matched controls were taken. Demographic details including age, sex, socioeconomic status, etc. were recorded. Detailed history was taken. Any associated systemic conditions were noted. All patients underwent complete examination, preoperative visual acuity, tonometry, slit lamp, biometry, and fundus examination. Associated ocular comorbidities were identified and noted, including corneal opacity, any degeneration dystrophy, posterior polar cataract, senile meiosis, pseudoexfoliation syndrome, uveitis, zonular dehiscence, complicated cataract, and so on. All patients were planned for phacoemulsification surgery with IOL implantation under local or topical anesthesia. 1 clear corneal incision and 2 side ports were made. Continuous curvilinear capsular access was done using cystitome, followed by hydrodissection and phacoaspiration of the lens matter. PCIL was implanted following this and the wounds hydrated. Any intraoperative complications like zonular dehiscence, iridodialysis, vitreous loss, posterior capsular rent, ACIL implantation, aphakia, and conversion of phaco to small incision cataract surgery was noted. Patients were examined post-operatively on day 1 for early post-operative complications, and visual acuity was recorded. Now, according to the WHO, the classification of visual acuity for cataract surgery outcome that was used in the study, good outcome was BCVA better than 6 by 18, borderline was BCVA between 6 by 18 to 6 by 60, and poor outcome was BCVA less than 6 by 60. Coming to results, a total of 100 eyes of 100 cases with cataract and ocular comorbidities who underwent phacoemulsification surgery were analyzed. Of the 100 cases, 56 were males and 44 females, and the mean age at surgery was 61 plus minus 11.73 years. Now, the most common presenting ocular pathology was corneal opacity in 31 patients, followed by posterior polar cataract in 25, uveitis in 19%, pseudoexfoliation syndrome, zonular dehiscence, senile meiosis, coloboma, and complicated cataract. The common intraocular complications encountered were conversion of phaco to SICS in 18 patients, vitreous loss in 15% patients, posterior capsular rent, iridodialysis, implantation of ACIL, aphakia, and there were no complications found in 28 patients in the case group. As we can see in the graph, the intraocular complications in the control group is much lesser compared to the case group, and the p-value is significant, that is less than 0.05 for each of these. Now coming to the post-operative visual acuity, it was better in the control group. In 88 patients in the control group, the visual acuity was better than 6/12 as compared to 44 patients in the case group. And again, the p-value here is significant. It is less than 0.0001. Now coming to discussion, cataract is the leading cause of blindness worldwide, and in India the numbers are increasing due to a substantial increase in population over 50 years in the last decade. Although upgradation of technology, type of machines, types of lenses, and surgical expertise, the number of cataract surgeries has substantially gone up along with better results. However, coexisting ocular comorbidities may cause intraoperative and post-operative complications with poor visual outcome. Our aim was to study the outcome of cataract surgery in patients with coexisting ocular comorbidities that cause technically difficult surgery. In our study, it was evident that presence of comorbidities increased the complication rate. The most common presenting comorbidity was corneal opacity. Most common intraocular complication was found to be conversion to SICS, followed by vitreous loss and PCR. Post-operatively, only 44% patients had vision better than 6/12. In a study done in Liberia in 2019, total 573 eyes were included, out of which 82 had ocular comorbidities. 23% patients had posterior capsular rupture, and 21.9% patients had zonular dehiscence, which is comparable to our study.
No, you need to wind up. Your time is over.
And our study is also comparable to a study done in Nepal, where good, borderline, and poor visual outcome were found to be 41%, 45%, and 13% respectively. Conclusion, this study shows that rate of intraoperative complications is higher in patients with pre-existing ocular pathologies. Detailed preoperative evaluation and identifying any pre-existing ocular pathologies is crucial before cataract surgery. This could help in improving outcome by optimizing patient selection and surgical approach. The limitations of the study was that it was a single center study and the sample size was small. Thank you.
Thank you, Dr. Manu. And I request all the speakers to stick to your time, because you will be rated based on your time also. So otherwise you will lose the marks. Okay. So one question, what's one limitation that you have in this study apart from the two that you have mentioned? Or what is new in your study?
Sorry, sir?
What is new in the study?
Sir, we are trying to find out, like we are emphasizing the pre-operative workup that should be done and counseling of the patients, so that we can better handle the surgical approach of the patient and also better counsel the patient. So that post-operatively, even if the visual outcome is poor, then the patient will not be very dissatisfied.
Thank you.